How to fine-tune insulin pump settings for diabetes. Have you ever wondered how to adjust your insulin pump settings for better blood sugar control? Fine-tuning your insulin pump can make a big difference in managing diabetes effectively. Let's break down the steps to get you started. First, it is essential to understand the basics of insulin delivery. The basal rate is the continuous insulin provided throughout the day. This helps manage blood sugar levels between meals and overnight. The meal bolus is the insulin dose given at mealtime to cover the carbohydrates you consume. Lastly, the correction bolus is an additional dose to bring high blood sugar levels back into the target range. When setting up your insulin pump for the first time, calculate your total daily insulin dose from your previous therapy. It is a good idea to reduce this amount by about 25% to avoid taking too much insulin. Next, divide the reduced dose roughly in half. One half will be for basal insulin and the other half for boluses. To set an initial basal rate, divide the basal portion by 24 hours to get an hourly rate. Now, let's focus on fine-tuning the basal rate. Monitor your blood sugar levels frequently, ideally every 2 to 3 hours, especially when fasting or between meals. Adjust the basal rates hourly to keep your blood sugar stable. This process may take about a week, so focus on one specific time segment at a time for accuracy. Next, it is time to adjust the meal bolus. Use carbohydrate counting to estimate how much insulin you need for your meals. If your blood sugar rises too high after eating, consider increasing the bolus. If it drops too low, you may need to decrease it. For the correction bolus, use the insulin sensitivity factor, which tells you how much 1 unit of insulin will lower your blood sugar. Adjust these doses carefully to avoid giving too much insulin too close together, which can lead to low blood sugar levels. Many pumps can calculate correction doses while considering active insulin still working in your body. Ongoing monitoring is vital. Keep detailed records of your blood sugar levels, insulin doses, carbohydrate intake, and physical activity. Collaborate with your healthcare provider to review this data regularly and make small adjustments as needed. Trust the pump's calculations, but also learn how to interpret and respond to your blood sugar trends. When fine-tuning your settings, choose stable periods in your routine. Avoid making changes during times of illness or significant lifestyle shifts. Increase your blood sugar monitoring frequency during adjustment phases. Also, educate yourself on how factors like exercise, stress, and illness can affect your insulin needs. Utilize features on your pump, such as temporary basal rates, for exercise or sick days. Fine-tuning your insulin pump settings is a gradual process that requires patience and careful monitoring. With consistent effort, you can achieve better blood sugar control and improve your quality of life while managing diabetes.